Hey beauties, welcome back to my channel. If you're new here, welcome and thank you for tuning in. My name is Laverson. I am your host and the founding owner of beyondbody.com. But if you like to learn more about me, you can do so at iamlarise.com. So in today's episode of Let's Ask a Surgeon, we're going to be talking to Dr. Laverson about revisions. Have you had surgery and you decided that you needed a revision after a couple of months has gone by, or even after a year has gone by? Have you had that thought in your mind, like, I think I want to revisit this and get a revision? If so, you definitely want to tune in to hear what Dr. Laverson has to say about revision.
Oh
How
my
are you
gosh.
doing?
Hi, Laurice. Thank you for sharing your audience with me. It's
Yes.
such a privilege and a pleasure.
Hey, it's always a privilege and a pleasure to have you here, to educate the world. Like, this is, for me, this is so much about knowledge and educating people, because you can easily go and Google search stuff or, hear word of mouth. But I feel like it's always good when you can hear it from the person that does the surgery. Even though there's more than one surgeon, it's still always good to hear it from someone that is in the profession, that has been doing this for years. Like, I feel like you can do this in your sleep.
Yeah, it's been a long road.
Yeah. So you definitely have a lot of wisdom and knowledge under your belt. And, that's why I like to do these videos, because you're not just some random person talking out, the side of your mouth or whatever. Like, you know what you're talking
Mhm.
about. So it's a pleasure to have you here. It's a pleasure just to pick your brain. So I appreciate that.
Yeah.
All
Well,
right.
what's the question for today, Laurice?
All right. So, general, what is a revision?
Okay, so revision is a change. Revision's a change, and we all know about changes. I mean, you buy a software, there's updates. You if you paint or draw, there's something you're not happy with, you change it. So revision is when the whole purpose of these surgeries is to benefit the bearer, okay, benefit the patient. And I always say, we surgeons have in our mind the result that we want, but listening to the patient and trying to achieve for that patient the result they want is really what's most important. The good result is defined by the patient. So if a patient comes back and something that's happened during surgery, they're not quite happy with, well, if that can be adjusted or changed, usually it's a minor little procedure under local anesthesia or something like that. We're going to want to do that. and
Mhm.
and um, and patients at the same time should understand that we surgeons during surgery, there are some basic principles, and I don't want to go on and on. If your audience has questions, I want to answer them, but in general, we surgeons want to do the least surgery possible to get the result the patient wants, because the more surgery we do, the more scarring, the more bleeding, the longer the scars, the more potential complications. So if you can do a lesser surgery and still get the result the patient wants, in general, that's good. But sometimes, Laurice, we haven't done enough surgery. And the patient says, look, doctor, I don't mind this longer scar, but I don't like this particular thing, if there's still extra skin, I'll say, well, I can take out that extra skin, but the scar is going to be longer. They say, no, doctor, I don't care about the longer scar. So I'll say, fine, as long as they know the trade off. So in
Hmm.
general, we surgeons make decisions sometime uh, um, that we think may be in the patient's best interest. You can always make the scar longer, but you can never make it shorter once it's there. So sometimes because I've made a scar shorter, it's not the result the patient wants. And if they're willing to accept a longer scar, I'll do it in a revision procedure, minor revision. I don't like charging for those. Sometimes we have to charge if the patient goes back to the operating room, um, but revisions are just they're updates, they're improvements. They're things the patient wanted when they're awake, when they wake up and heal up, that they see that they don't like. You know,
Right.
I don't want them to live with something they're not happy with for the rest of their life.
That's true.
Yeah.
That's true. Okay, so then the next question, you sort of touched on this. Why would one need or choose a revision? So you already answered that, so I'm gonna skip that
Well,
unless you have something else to add.
well, what I do have to add is timing, because once the surgery happens, that's just the beginning of healing. And I say, before you even think about doing a revision, before you even think about, hey, I don't like this part of my result, you got to let the swelling go down, let the ripples and wrinkles go away, whatever kind of surgery it is, let things settle down and heal. Only will I do a revision in general on a stable result. And the
Hmm.
result takes healing takes months. I mean, it takes a while for the result to be stable.
Right. Okay, I agree. Are revisions an uncommon thing?
Unfortunately, I would say no, they're not uncommon. I would say about half the surgeries I do, there's some kind of revision, almost half, maybe a little less than half, but some surgeries more than others. I would say breast augmentation is something I do. Revisions are not that common. Even facelift, I mean, revisions are not that common. Neck lift, not that common. Rhinoplasty, I would say occasionally. The nose. Um, Tummy tuck, it's pretty common, because tummy tuck, the belly moves around a lot. I mean, with positional changes. I'm doing the operation when the patient is still laying flat on their back. Of course, I plan it when they're standing up. I make the markings and everything. But in general, once patients, few things happen during healing. The skin stretches out, and the patient moves around, and they can have a contour they don't like. So I would say tummy tuck is one of the more common procedures for me to have to do some kind of revision
Okay.
for whatever reason. But no, they're not uncommon, in answer to your question.
Okay, cool. Um, how are scars revised? Like you did touch on it, like you can't make a scar shorter, but you can make it longer. Like I never even knew there was a such thing as a scar revision because in my mind, it's like the scar is there. Like, how do you fix a scar? If you don't like how the scar looks, how do you fix that?
Okay, well, that's a really good question, and it's very individualized. It depends on what it is about the scar that is not working out for the patient. For example, it could be the location of the scar. Maybe she's wearing something and it shows, it shows in clothes that she likes to wear, in a swimsuit she likes to wear. I don't want that. So that's scar position. Then there's scar coloration. If the scar is like red, or if it's dark and their skin is lighter, or if it's light and the skin is darker, or if then there's the texture of the scar. If the skin is smooth but the scar is like rippled and wrinkled, then that causes shadows, little minor shadows, and it makes the scar visible. Anything that makes a scar visible is could be a problem. So it's position of the scar, it's character of the scar, it's color of the scar, and of course length of the scar and location of the scar. I mean, so depending on what it is the patient doesn't like about the scar, how do we make it more suitable?
Hmm.
Okay, if it's the width of the scar, there's a big wide scar. That's a lot of times it's from tension or from the technique of closure. So you want to find out what it is about the scar, and you want to change whatever it is that made that scar visible. okay, and you want to adjust it so it's more suitable for the patient, for what they wear, for their lifestyle, for their own personal preference. So how it's revised could be surgery, could be laser, could be injection, could be any number of things,
Mm,
any number of techniques to make a scar look better.
that's
Filler,
interesting.
yeah.
Very interesting because I never thought about laser, any of that. I don't even know how I thought it would go. Like, um, do you have to like cut out the old scar and then like re-sew the skin together? You know what I mean? Like,
Yes, I would say, Larice, that's the most common way that I revise scars, just by redoing the whole thing.
okay.
The advantage of that is you can change the scar position. You can change, so if there's a divot, if the scar is sticking out, or if it's depressed, you can improve that by surgery. You can change the most about a scar by surgery. But sometimes you don't want to do surgery. If the scar is hypertrophic, meaning sticking out a little, sometimes you just do a steroid injection or 5-fluorouracil. These can help scars that are visible because they're metabolizing, making extra collagen. They don't know when to stop. The healing process is continuing. Keloids, sometimes we'll do
Yes.
steroids. Sometimes you got to take it out. Sometimes even radiation after you've revised it. So all these things to try and control the healing process, because scarring is the result of healing, and try to control it, but ultimately it's just nature.
Hey, well, shoot, you just taught me a lot just in this one question. I didn't know there
Yeah.
was so many different details as to why one might need or want a scar revision. So thank you for educating me for sure.
Well, thank you, Larissa. And the bottom line is, you don't want to see the scar. I mean, listen, the woman, if it's a body surgery, she wants to be sexy. She wants to be beautiful. Scars are not part of that. I don't even want the scar seen. If she wears this little string thing on her bottom, I want the scar behind that. I don't want it
Hmm.
seen. And same thing with the breasts. You want those scars to melt away. Some
True.
people, unfortunately, just the way they heal, the scars aren't good. They're visible, and it can just destroy an otherwise good surgical result if the scar is seen. I don't want
Right.
the scar seen. I don't want evidence of surgery. You know,
I like that. I like
yeah,
that. All right, next question. When a revision is performed, is it done under local or general anesthesia? Can you give an example of when one would be used over the other?
yes. Well, local is generally preferred because it's less expensive, it's less invasive. It's just injection of some anesthesia around the scar and then doing whatever you need to do to that scar. It numbs the area like when you have dental work, it's local anesthesia usually. Um,
Hmm.
but if you have to move the scar, or, for example, move an implant so that you change the crease, so the scar's in the crease, I mean, these are more involved. And or if a patient, some patients get nervous under local anesthesia. They don't want to know, they don't want to hear anything, they don't want to feel anything. Those you have to do under general if the patient can't tolerate a local anesthesia, or if it's more involved. Like, for example, a tummy tuck, if you want to lower the scar, if she's wearing these low, bikini line, you want to lower that tummy tuck scar. So you got to put them to sleep usually to move that skin down again and lower the scar. For yeah.
Okay. Okay, shoot. That explains it quite well.
The face you can usually do under local.
Okay.
Usually, yeah.
Okay. Well, thanks
Sometimes
for that.
facelift scars around the ears or something. I've seen patients come in that maybe I didn't do their initial surgery, but I had this one patient who had a brow lift with a scar right here that you could really see it was red, and I think I did some of it under local, some of it under general. You know, it
Yeah.
took a few procedures to fix that.
Dang. Okay.
Yeah.
Next question. If a revision requires general anesthesia, does the surgery typically take the same length of time as the initial surgery?
Generally not, Maurice. It's much less complex to do a scar revision, even if you're moving tissue around and changing the location of the scar. It's not it's much less surgery, much less recovery, usually, and usually it works out pretty well. Patients can get back to their activities usually much quicker than after the initial procedure.
Right. Yeah, that that's something that I noticed. Um, uh, for me personally, like I was able to get back to like normal much quicker than the first time around. So I can speak that one from experience. All right. Next question is, does it cost to get a revision? What determines if a revision is free of cost or requires an additional fee?
Well, that's a good question, also, and it varies with the physician. Some doctors will charge for every service, and some will not if it's a revision. My feeling is this: that if a patient has something they're not happy with, and they're looking at it every day in the mirror, they cared enough about their appearance at that particular part of their body that they got a major plastic surgery to improve it, that and if there's something they're not happy with, I'm not happy with it either, in general. And sometimes if it costs, it, patients finance these procedures. Sometimes they're still paying for the initial surgery, and if they're not happy with it, I'm going to do everything I can to improve it. And if I throw up a cost, sometimes they'll say, you know what, I can't afford that now, and then they're living with it and they're not happy, and I don't like that. So I'll do it, if I can. I will do it at no cost to the patient, just so I can fix the problem and make them happy with their result. Sometimes, however, if you have to go back to the operating room, you're paying. It's very expensive. You're paying anesthesia. Surgery is costly. It
Mm-hmm.
just is, especially in the United States, because we have a lot of rules and regulations around surgery, licensing, accreditation, requirements, nursing staff, licensed personnel, sterile equipment and supplies, disposables. My God, they go on and on and on. Being a doctor and doing surgery is extremely costly. And the honest truth is, I'm just telling your audience, my markup is very little. We do not make money here. Many years I will actually lose money. And but but at the same time, I want patients happy. I don't, I don't want them unhappy. So we share the risk, we share the cost, and I'll try and do revisions at absolutely minimal cost. But sometimes I have to charge because I'm going to
Mm-hmm.
get a big bill from my anesthesiologist. My nurse needs to get paid, my OR expenses, and on and on and on. And if that's an operation that's going to take a few hours to do, and I'm putting everything I have into it, the patient's going to have to share the cost. And usually I will do it in such a way, even if the patient has to pay, they're not paying the whole cost of it. Okay, so I do end up paying for some of that surgery, and I can't afford to stay in business if I'm paying for everybody's surgery. So
Right.
so so, but I'll still, out of goodwill and good faith, do the best I can for that patient, so they have to pay the minimum, um,
Okay.
to get that revision.
I like how you broke down, like, you know, in the United States it does cost more because of this and this. Like I feel like so many people need to hear that, because you get people that's like, "Oh, well, I could just go to Mexico and it's cheaper." You can, but I rather, this is just me personally, I'd rather pay double, triple, quadruple, knowing that I'm in the best care, because you had to go through the lengthy process of getting certified, getting licensed, and
Yeah.
all of that. A peace of mind is so much better than a discount.
You know, Loris, you're right. I mean, there are good surgeons in Mexico, okay, but the truth is, surgery is there's always risk, and you have the consumer, meaning the patient, has much more consumer protection here. You have the medical board, you have the plaintiffs bar, attorneys here. In Mexico, if something goes wrong, you can't even get your medical records sometimes. And I've seen I don't even want to tell you about the tragedies that we have seen there. At the
I've
same
seen
time,
some
we've seen
too.
good results. Okay, I'm
I've
not
seen
saying
good
don't
too.
go to Mexico. You can go to Mexico for your surgery, A lot of people go down there for dental work. It's much less expensive, but there's a
Hmm.
reason it's less expensive. And surgery, when everything goes well, it's great. But when things
Hmm.
don't go well, you're not.
Right.
Um,
Right.
you're much
I
more
I
protected up
agree.
here.
100%, man. Like I've seen some nice surgeries that came out of Mexico, and I've seen the flip side as well.
Yeah,
And like I said, it's just a peace of mind, knowing that you have that extra level and layer of protection. So like I really appreciate how you just dug into this question and pointed out
thanks.
this, and this is why we cost more here. Like people need to hear that.
Yeah,
So thank you. Thank you so much for that. All
yeah.
right. So the last question that I have is the recovery time for a revision the same as the initial surgery? Does the body heal quicker the second time around because it's already been through the process? So, like, I don't know if it's like called muscle memory, but like because your body is familiar, I guess, with that trauma, does the body know how to heal itself quicker than the first time around?
Yeah. Well, here's what I say. I mean, some things are quicker because the revision's less. I would say the return to physical activity is usually quicker. That aspect of recovery, return to activity is generally because it's a smaller surgery. But the scar itself, if the revision is a scar revision, you're starting healing of that scar all over again. And is it going to be quicker or not? Well, it's very individualized. And sometimes, Larice, even a revision, say I revise a dark scar or a red scar or something like that. I've had some patients where I've had to do more than one scar revision. The revision I do doesn't heal well. They're not happy with it. I've had to do a second one. And maybe part of the scar, you don't have to do the whole scar again, but if there was tension on an area or if one area didn't work out, I'm still not happy if it doesn't look good. And so I would say they're starting healing all over again. That's why I don't like doing a revision unless it's clear that it needs to be done because they're starting
Mhm.
all over again with a new scar. So and that's unpredictable too. So some things are quicker, like the return to activity maybe, but some things aren't. I mean, you're still reopening the skin and reclosing it, So
Right. I man, I feel like I don't want to say this is the best episode we've done, but I feel like this is one of the top ones, man, because it puts a lot of things into perspective. Um, so people aren't going into surgery with unrealistic expectations, like because I feel like some people think, okay, I'm gonna go get surgery on X, Y, and Z, and you know, it's a one-time thing. Like for the most part, we hope and pray that it is one and done, but that's not always the reality. And just to be able to have the truth and the knowledge moving forward, just in case it is not a one and done, like you need to go
yeah,
into it knowing exactly what can happen. And so
yeah.
like I just feel like this episode is so amazing. Like I
Well,
love it.
it is, Larissa, and patients should understand. Look, I mean, these big software companies, they're always coming out with updates. I mean, you see it on your phone all the time. You have to update your computer. Things get better, things change. I've had patients after surgery lose weight, which
Mhm.
changes the result. They'll need a
Yes.
revision because your body changes every day and we get older. But this is why, Larissa, I do think that your audience should understand when you go in for a surgery, a cosmetic surgery, you want to have a doctor that you can have a relationship with, because if things don't work out, is this somebody I can come back to and say, look, I don't like this or that. I mean, I really, really would like. Then what's going to happen? I mean, is
Yes.
it gonna? What's the expense going to be? What's the process going to involve? Um, how often does that happen? These are things that I think are nice for your audience to understand. They should try and clarify up front.
Yes. I think you just hit the nail on the head when you said have a relationship, or at least try to, because at the end of the day, like when people go to consultations, I always say, like, you got to feel the vibe, not just the surgeon, the staff. From the moment you walk in the door, it's a whole vibe, and these are people that you're trusting with your life. Like,
Yes,
that's how
great.
serious this is. Like, these are people you're trusting, and if you don't feel comfortable or have the slightest like, I'm not feeling it, like, that's not your surgeon. And just like in the instance of revision, you want to feel comfortable. You don't want to dislike something with your results, and then you feel like you can't come to your surgeon and talk to him because you're afraid of how they're going to react or perceive, or turn you down or whatever. Like, it's always good. And I feel like, I could be wrong, but I feel like that's probably the instances where people go and get a revision, but their revision is not with their surgeon. They go to other surgeons because they don't have that relationship, or they don't feel comfortable enough to talk to their surgeon. So they go look outside of who did their initial surgery because they don't have that relationship.
No, no, this we're in a service business, and patients should always understand they're paying their money and they're taking the risk. And I agree with you, Larice. The patient should you got to go to enough consults and meet enough doctors that you feel comfortable with the doctor that you've chosen for this procedure. And it may not be perfect the first time, but I understand patients aren't coming for a surgery, they're coming for a result. And of course, I designed the first procedure to get that result. But if it doesn't, I still want to get them what they came for, which is that result, even if it takes,
Right.
a revision, an adjustment, a change. You want them in general happy with it, and that's all.
That that's the difference between a good surgeon, that really, that it's their passion. You definitely can notice ones that are doing it just for the money, and the ones that are really passionate about it, because that's your name, your brand that's going out there. And if you're not happy with it as the surgeon, and if the client is not happy with, or the patient is not happy with it, and you want to fix that, because that's your name going out there, your product, your results. And so, that speaks volume as to, what type of surgeon you are, and what types that are really out there, that are just for the money.
All right. So I'm going to
Yeah.
subscribe at I am Larice. We subscribe at I am Larice.
Thank you, Dr. Laverson. You're awesome. I
Yeah.
appreciate your time. It's always awesome talking to you, man. Look, I gotta
Well,
find another reason to
thank you.
come visit you guys.
Anytime, Larice. We always like seeing you here, and your two wonderful sons, Bryson and
Yes.
Lamarcus.
Yes,
Your two
man.
well behaved, wonderful
Sometimes.
sons.
Sometimes. All right, Dr. Laverson, I won't hold you. You have a good day. Thank you so much for your time.
Thank you.
Revisions. So hopefully you found value in this episode. Like I said while he was on there, it's not just because he was on here. Like, me personally, I feel like this has been a very, very educational episode. Like, all the episodes we do, I feel like, are educational, but this one, it took it up a couple notches, because it puts things into perspective. It shed a light on a lot of things. I really love how he dove into, why it's more expensive in the United States. I really like how, he showed his genuine self, letting if he's not happy with the results, he wants to fix it. He wants you to love your body, love your results. We go in there, we have a vision in mind, we pay our money, and we expect a certain outcome. And I like how, we got into how think your expectations need to be realistic. So before you even go into surgery, you need to, have all the information that is needed, and go in there with clear expectations. And, just, oh, guys, this was an amazing episode. So again, my name is Larice, And if you find this information valuable, if you know someone that can benefit from the topics that we talk about here on this channel, please send them my way. Make sure you like and subscribe and turn on the bell notifications so every time I do upload a new video, you will be notified. And before I end this video, just as an FYI, I realized that I'm supposed to be pouring out content for you guys on a weekly basis. But as you can see, and as you know, I am interviewing a surgeon. So sometimes that is not going to always be possible. Like, I am pretty much on his schedule. He has patients, he's doing surgery. So, sometimes it just does not pan out for me to be able to bring you another episode of Let's Ask a Surgeon on a weekly basis. But trust me, I do try very hard. But again, he is a very busy surgeon and I am on his schedule. Whenever he is available, I clear out my schedule so that I can be available to make these videos for you guys. So with that being said, take care, stay tuned until the next time. Bye, beauties.